Good evening, and welcome to the Connecticut United Ways first virtual ALICE Town Hall. My name is Lisa Tepper-Bates, and I'm the President and CEO of United Way of Connecticut. In early September, Connecticut United Ways released the 2020 ALICE report, the fourth ALICE report for the state of Connecticut, a report on families who are asset limited, income constrained, and employed in our state. The 2020 ALICE report revealed that even before the onset of the COVID-19 pandemic, 38% of Connecticut households were walking a financial tightrope and struggling to make ends meet. While traditional economic measures do not yet capture what ALICE workers and their families are experiencing during this unprecedented public health emergency, we know that the COVID-19 pandemic and the resulting economic crisis has disproportionately impacted households living below the ALICE threshold, in particular female-headed households and households of color. When we talk about ALICE, it is important to recognize that we all know ALICE. ALICE is the essential healthcare worker caring for our aging parents at home and for COVID patients in our hospitals. ALICE is the teaching assistant who helped our children adapt to virtual learning, or the bus driver who gets our kids to school. ALICE fixes our cars and works in our local shops and restaurants. ALICE is our friend, neighbor, coworker, and family member. We and our economy lean on ALICE for support in a number of ways. Yet right now, ALICE households are struggling to feed their families, ensure their medical care, maintain their housing, and access affordable childcare. The focus of our ALICE Town Hall this evening is on this last category of essential support for so many Connecticut families, childcare. For families with children, childcare is often the largest monthly expense, and finding childcare that meets the needs of your family is often difficult. 44% of Connecticut families live in a so-called childcare desert, defined as having no childcare providers at all or so few options that there are 3 times as many children as there are available licensed childcare slots. The Connecticut United Ways are thrilled to bring together today 4 subject matter experts to talk more about access to childcare and to discuss solutions that can help our state better meet the needs of children and families. Our panel this evening includes Commissioner Beth of the Connecticut State Office of Early Childhood, Emily Byrne, Executive Director of Voices for Children, and Kimberly Martini-Carvel, Associate Director for Capacity Building at the Connecticut Children's Medical Center and Executive Director of the Help Me Grow National Center. I'm grateful to Melissa Stanley, Program Manager of the Boys and Girls Club of Stamford, who will serve tonight as our moderator. Thank you for making the time to join our ALICE Town Hall this evening. Thank you to our wonderful panelists and moderator. And thank you for supporting Connecticut's United Ways. Together, we can create a path to a more stable and financially secure future for our ALICE households, parents and children alike. And now I'll turn it over to you, Melissa. Thank you.
Thank you, Lisa. Hello, everyone. My name is Melissa Stanley, and I am the Program Director at the Boys and Girls Club of Stamford. I also chair United Way of Western Connecticut's ALICE Advisory Board. This board is staffed by members of the community who identify as ALICE and work together to make their voices heard and their lives a little easier and more fulfilling. As mentioned by Lisa, I will be moderating this evening's virtual town hall. I'd like to introduce this evening's esteemed panelists. Let's put some names to their faces. Please welcome Commissioner Beth from the Connecticut Office of Early Childhood. Hello, Commissioner. Please welcome Emily Byrne. Thank you. Please welcome Emily Byrne from the Connecticut Voices for Children. Hello, Emily. And please welcome Kimberly Martini Carvel from Connecticut Children's. Hello, Kimberly.
Hello.
Thank you all for leading tonight's conversation surrounding a major trend of the 2020 Connecticut United Ways ALICE report, Access to Childcare. And thank you to all who are tuning in for tonight's conversation. I would like to encourage you all to interact with one another in the chat room. You are invited to submit questions for our Q&A portion of tonight's program. You may hear us say ALICE several times throughout the program tonight. If this is a new phrase to you, ALICE is United Ways coined acronym that stands for Asset Limited, Income Constrained, Employed. Despite working hard and often working multiple jobs, ALICE households struggle to make ends meet. ALICE families have to make incredible difficult decisions every day as they balance their household budgets. The ALICE report is a financial hardship study released every 2 years by the Connecticut United Ways. I encourage you to visit alice.ctunitedway.org to download a copy of this year's report. According to the ALICE report, statewide, 38% of families fall below the ALICE threshold. That's nearly 4 out of every 10 households. Here is an overview of ALICE household survival budget. This is an estimate of the minimal total cost of household essentials such as housing, childcare, food, transportation, healthcare, and technology, plus taxes and miscellaneous contingency funds equal to 10% of the budget. It does not include savings, auto repairs, cable service, travel, laundry costs, or amenities such as holiday gifts or dinner at restaurants that many families take for granted. The actual cost of household basics is well above the federal poverty level for all household sizes and types. The hourly wages needed to support these budgets is $14.45 for a single adult, $15.88 for a single senior, and $45.33 for a family. To put this in perspective, the median hourly wage for the most common occupation in Connecticut, which is a cashier, is $11.49 per hour, or $22,980 annually. This is not enough to support any ALICE budget. Public assistance programs are based on the federal poverty level, but that is not enough for households to cover even its most minimal costs. This means assistance programs serve far fewer households than actually need assistance, even in a strong economy. As Lisa mentioned in her introduction, access to quality, affordable childcare is a significant trend in the 2020 Connecticut United Ways ALICE report. In previous reports, we have often held up the fact that childcare and housing combined make up more than 50% of ALICE household survival budget. But in the 2020 report, researchers went beyond the challenges related to the expense of the childcare and looked at an emerging trend across access to childcare. The researchers who published the report coined a new term in our most recent report, childcare desert. We've heard of the term food desert as it relates to an area that does not have access to nutritious foods such as grocery stores. This is similar. Childcare desert means an area that does not have access to quality, affordable childcare. Access to childcare, or lack thereof, is important because in the short term, parents and guardians may need to rely on family, friends, neighbors, or uncertified childcare providers to take care of their children while they are at work. Sometimes childcare may fall through, and people will need to call out of work and to stay home with their children. As you can imagine, if this happens frequently, it can impact someone's employment status, and at its very least, it will impact their paycheck. In the long term, when children are not enrolled in quality early childhood programs, it delays their achievement of development milestones. Ultimately, it could impact a child's likelihood of graduating high school on time and prepared for college or a career. Another thing to keep in mind throughout tonight's program is that oftentimes, childcare providers are frequently ALICE themselves. And while these are not new issues, They have only exacerbated with the onset of COVID-19 pandemic. To help us take a deeper look at the data surrounding access to childcare for Connecticut families is Commissioner Beth from the Office of Early Childhood. Hello, Commissioner.
Hello. I just want to make sure there's no echo. Does that sound okay? It's great to be here. Really grateful to the United Way and Lisa Tepper Bates for their focus on this area. I'm really happy to be here with Emily and Kim and you, Melissa. Thanks for what you do every day for children and families with the Boys and Girls Club in Stamford. So I have some slides that I'll walk us through. So Connecticut has an Office of Early Childhood, which is unique. It's been supported by a lot of early childhood advocacy groups across the country that states need an office that's focused on young children, particularly on that phase of development and policy making. And so our mission is to support all young children in their development by ensuring that early childhood policy, funding, and services strengthen the critical role families, providers, educators, and communities play in a child's life. And our vision is that all children in Connecticut have access high quality care. And I think for us as well, and the pandemic is making this show more than ever, is that families really are at the center. And our role at OEC is to lift up family voices more and to support family needs as they're that play that critical role for the child throughout their life. Okay, next slide, please. So what we know is that there are really three critical reasons why childcare is so important. First of all, it's supporting early brain development, and we know it's one of the best investments we can make as a society is at that critical phase of development to be supporting young children's brains with warm, responsive care and learning. It also allows parents to remain working, and we're seeing, I'm sure many of you have seen the reports in the newspapers over the past month about how many women have left the workforce. That has big implications for our nation's economy, for our state's economy, for families' economic viability. You just heard Lisa talking about families walking a tightrope, 38% in Connecticut. That number is just going to go up as women leave the workforce. So childcare allows parents to stay in the workforce, and some men left the workforce as well, just surprisingly, but not nearly as many as women left the workforce. The other thing is childcare is a business in its own right, and it employs people mostly underpaid, but it's really critical for our state's economy now and for the future. And if we are just very black and white about it, we're growing the next workforce. For me, it's that you want to give every kid the best day they can have every day of their life, and high quality early childhood education does that. And you can't miss out on how also early childhood educators support families. That's a missing piece for families right now whose children aren't enrolled in programs. Okay, next slide, please. We had big challenges in childcare before COVID, and that's only gotten worse. We know that more than 70% of parents where the only or both parents are working. Connecticut before COVID was very short on infant toddler spaces, short 50,000 spaces for parents who needed to go to work, leaving children sometimes in unsafe setting, and parents with impossible choices with those very young children. A third of Connecticut towns have insufficient preschool slots. So that's a real problem. And then there are equity issues. Infant toddler care is very expensive because of the ratios being 4-to-1. But we know that while 80% of families cannot make enough money to pay for the full cost of high quality infant toddler care, 94% of Black and Hispanic families. So this is before COVID. And then COVID hit, and our childcare capacity right now, I think this week we're up to 68% of our pre-COVID capacity. It's changed a little even since I made these slides. We know we've lost more than 50 programs have turned in their licenses for good. So we've been losing programs, both centers and family child care homes. At the same time, we've been pretty focused on reopening family child care homes with a strategy of staff family child care networks, which I can talk about more in a bit. And overall, the Center for American Progress is estimating the impact on childcare businesses is that Connecticut could permanently lose 40,000 childcare slots. Now, we were already short 50,000, and now you add 40,000. This is a really big challenge. And one strategy that we've employed is to support our family childcare homes. We're finding that families are choosing family childcare right now because of the smaller sizes. Melissa, I think, talked about childcare deserts. We have childcare deserts. About more than 40% of Connecticut is a childcare desert. So family childcare networks are a strategy to build up small programs across the state in all different communities. So things were tough prior to COVID and they're worse now. Okay, next slide. This slide really will just show you what's happening in terms of what's open and what's closed. So here on the far left, you have child care centers. You can see that about 74,000 are open now. There were 174,000 spaces in centers before the pandemic. After the pandemic, I'm sorry, there were 101,000 spaces before that. And then you heard what I was talking about with family childcare, that families have been choosing family childcare. We're up over 80% of family childcare homes have now reopened, but it's not that big a part of the supply. So while we've made progress here, that's a small part of our supply. Next to that is group homes, which they're very few and they're coming back some. But the place we lost the most ground was in exempt programs. Those tend to be public school programs or city or town run programs. We have not been able to build up capacity there. So when you look across all of these bars, you can see that we're losing ground on childcare capacity in the state. And this is through the end of October. Our new reports show a little more open, but this is not going to change that much for the rest of the year. Okay, next slide, please. So overall, it's gone up a bit. It was 64.6. Now we're up around 68 of our pre-COVID capacity. We had 40 programs that opened in October, so that was good, as well as family childcare homes. But I was explaining on the dropped licenses, 52 centers have let their licenses expire, 2 group homes, 102 family childcare homes. We had issued 83 family childcare licenses in that same period. So that's positive. And we have an extra effort going on right now, highly focused on 165 other family childcare homes that have applied to be licensed, and we're trying to expedite so families have more choices during the pandemic in small settings. Next slide. We went to the field. There was a great national study done by the Bipartisan Policy Center about what parents were doing during the pandemic. And we wanted to know what was our Connecticut specific data about what were parents doing for childcare in the pandemic in Connecticut. And this is just, you can see outlined how many families responded and what ages their children were, so that we could plan better and the programs could understand what parents were making, what choices parents were making. We wanted to hear directly from parents. Next slide, please. So what you see here is, you can see 0 is right in the center. This is how did childcare change before and after the pandemic. And what you see there is families were much less likely to be choosing school-based centers and childcare centers, and more likely to be keeping their children at home and relying on family childcare. Family and friends went down as well, and I think that probably has to do with the fact that a lot of families were concerned about leaving their children with grandparents, given the how hazardous it is for older folks to get the virus. So that probably explains that. But this has big implications for businesses. And 75% of our programs are private, totally paid by parent tuition. If more than 20% of parents say we're not choosing childcare centers anymore, there are big implications for those program survival. Next slide. And these were the reasons that parents said they kept their children home. You can see the big yellow is they're concerned about the virus, and or they didn't need childcare. They might have lost their job. They might be telecommuting and patching it together. Program closed was part of it, and unable to find childcare was part of it. But parents are really concerned about the virus. That's the story that this tells, and sometimes because of the pandemic, not in need of childcare. Next. So this just shows you, a family's quote about their worry about the virus, and well over half were very worried about being exposed. And this mirrors a lot of what we saw in the national survey by the Bipartisan Policy Center. Okay, next. Why is this? This is all important. Why is this all important? Well, it's so important for families. I want to start with it's important for children and families to have stability. If a parent has affordable childcare, it's like getting a raise. It can help them afford housing. If they don't have affordable childcare, they either can't work or they can't afford all the costs that you could see in that Alice report. So that's not good on a human level. But as a country, we have big challenges because we have not taken care of childcare, and it's impacting people at work. They're getting in trouble at work. It hurts their productivity. And Ready Nation reports that employers lose $12.7 billion annually because of childcare problems their staff have. So we all pay for this. Childcare is a public good, and I think as a nation we need to be thinking about it that way. Next slide. And then, the cold hard fact is childcare is a big part of our economy. It generates billions of dollars. So the national data is that it's almost $100 billion in total economic impact. So this is not nothing. This is something that we really need to pay attention to for our economy. Okay, next. And I think in our country, this quote from Sarah Savage, there's a wonderful report from the Federal Reserve Bank of Boston about childcare. It just is, in our nation, no one has really taken responsibility to say, we need to take care of this. I'm hoping that COVID will change that. We have definitely seen people recognize that, whoa, without childcare, what are we supposed to do? As schools closed and families were stuck and they didn't have childcare options, people couldn't go to work. And so I know Governor Lamont has heard a lot from businesses as they tried to reopen and had challenges. Right now at our office, we're working double time trying to support childcare for people doing the testing and in hospitals and in workforce development. That's a huge challenge. So I think that's my last slide, and I can't wait to hear from Emily and Kim. Thanks so much.
COVID-19 has exacerbated access to quality, affordable childcare. We appreciate you for shedding light on the data. To help us understand what Alice families are facing as it relates to childcare and its impact on the community health is Kimberly Martini Carvel from Connecticut Children's. Hello, Kimberly.
Hello, and thank you so much. I wanted to just take first to introduce myself a little bit. Kimberly Martini Carvel. I am the Executive Director of the Help Me Grow National Center and the Associate Director of the Office for Community Child Health at Connecticut Children's Medical Center. The Office for Community Child Health is a unit within Connecticut Children's that brings together programs, initiatives, and advocacy focused on the promotion of health, early detection of concerns, and interventions for all children, not only those with complex health conditions served by the hospital. The Office for Community Child Health connects a diverse array of existing community-based programs here in Connecticut, and especially in the greater Hartford area, to each other and to our community-oriented hospital programs to streamline services for families. We work to build stronger child-serving systems, we enhance innovations, and we strengthen the clinical care delivery for young children, for children, and for their families. Next slide. To explain a little bit about how this works together, we call this a nested collective impact model. Actually, could you move a little bit to the next slide, or could you move to the next slide? Thank you. So Connecticut Children's serves as an anchor institution that is dedicated to improving the health of children through family-centered care, research, education, and advocacy. Within Connecticut Children's sits the Office for Community Child Health, which focuses on bringing all sectors together that impact child development and well-being, such as early care and education, housing, and family support. Nested within that, at the Office for Community Child Health, is the Help Me Grow National Center, which is a program of the office, and it serves as a national resource to support the multi-sector implementation of Help Me Grow in communities throughout the country. Next slide. Across all studies and time periods, we just had Beth Commissioner Bai actually speak to this, and we're going to hear a little bit more, but just to reinforce, it has been concluded that early care and education increases cognitive and achievement scores and could account for nearly half of the kindergarten achievement gap between Black and white children. A long-term analysis suggests that early childhood education and care increases earnings in adulthood by 1.3 to 3.5%, and even higher for children of color. Early care and education programs can strengthen parents' attachment to the workforce and increase their earning potential by providing a safe, nurturing environment that furthers education and development that we know parents are already providing within their homes. And so this reinforces and allows for those experiences at increased levels. We also know that access to early care and education allows for increased mother's employment rates or maternal employment rates. Increase in family income is correlated strongly then again with the positive outcomes. Investments and access to early care and education correlates with a reduction of involvement with the criminal justice system at the community, at the state, and at the national level. We know access to early care and education at a community level increases academic achievement in kindergarten through 12th grade. It increases earnings in adulthood. It increases the supports or reinforces the experiences and education being provided at home. It increases the opportunities for stable, safe, nurturing environments for our community's children. It increases the rate of maternal employment, family income. It increases child well-being outcomes, and we see reduction in criminal justice spending. Next slide. So Dr. Paul Dorkin, 22 years ago, really saw within his practice as a pediatrician that too many children were needing interventions in the 2nd and 3rd grade here in the greater Hartford area. And he knew that these kids would have needed significantly less intervention or possibly none at all if there was access to supports and services at the earliest point possible. Dr. Dorkin led and brought together a diverse set of stakeholders and hypothesized that the systems gap was in the early identification of concern and need, and he facilitated a process for parents and providers to link young children to existing supports and services within a community. 22 years ago, a model was piloted called ChildServe. 18 months from the launch of that pilot, Child Serve went from serving the greater Hartford area to serving the entire state of Connecticut, and also evolved its name to Help Me Grow. Help Me Grow is made up of 4 core components, which are the gears represented on the screen, and 3 structural requirements. Help Me Grow isn't really, the special sauce we say, isn't really those core components or the structural requirements. It's an infrastructure that provides and facilitates families to continue to access a system and be supported in doing so, and helping to support providers for those gears to continue and participate in overarching child support system. Next slide. Sorry. Here is a map that represents at the close of 2020, which is right now. I sit, as I said, as the executive director of the Help Me Grow National Center, and I get to lead a vibrant national network across this country. It's made up of 32 states and over 110 communities implementing that Help Me Grow model I just talked about. Having Help Me Grow implemented nationally has served as a vital networked infrastructure that has been critical to state and communities' COVID-19 response. Next slide. So I wanted to share with you that in real time as possible, as the pandemic hit from the East Coast moving towards the West, we worked really hard to survey the national network. So those 32 states and 110 communities. And much like Commissioner Bai had just spoken about, we realized and were able to pinpoint some significant needs and gaps in the child serving system that our COVID-19 response had exposed or escalated throughout this country. Some of those things were emergency infant and toddler basic needs, diapers, food, formula, PPE and cleaning supplies for early care and learning, some type of centralized clearinghouse for essential workers, connection to subsidized childcare that was available and open, communication of and at times provision of food, clothing, and shelter, young child-focused developmental activities, virtual play groups, bedtime stories, and also virtual or call-based mental health services for caregivers and young children. Not all of the Help Me Grows across this country were meeting that list that I just shared with you, not everywhere, but many of them were, and they ended up being extremely critical to supporting a community's health. Next slide. As resources have become constrained or overwhelmed at the family, community, and state level, Help Me Grows throughout this country and here in Connecticut have pivoted and or enhanced the early childhood system of care. It has been a critical component for stabilizing businesses, workforce, safety net services, child health services, and so much more. As I talked about earlier, I sit within the Office for Community Child Health, which sits within Connecticut Children's Medical Center. We at Connecticut Children's Medical Center did not see childcare and early care and education as an essential need in order to support our workforce or the delivery of healthcare. That is a flawed model. As COVID-19 hit and the realizations of the impact on families, communities, and this state, it became critical for us to think through not only access to childcare, but the provision of it in a safe and healthy way. It was essential for us to be able to be responding to the pandemic and responding to the workforce so that we could be able to be responsive to the communities and the citizens. I think that the CCMC's story, or Connecticut Children's story, mirrors a lot of what we're seeing across this country. What was used to be something that was considered a luxury or something that was not necessarily prioritized when we talk about state budgets and national budgets has become critical and essential to our success and recovery from these unprecedented times. Next slide. Here in Connecticut, Help Me Grow Connecticut is operated by Child Development Info Line, or CDI. It's a program of 211 and Connecticut United Way. You can find Connecticut United Way, Help Me Grow Connecticut in 211 at www.cdi.211connecticut.org. Or you can call 1-800-505-7000. Staffed by early childhood care coordinators that can answer questions, talk about concerns, and connect to community-based resources. At Help Me Grow Connecticut, you will find a coordinated, up-to-date, and networked one-stop for identification of available early childhood resources, open and enrolling programs, developmentally supportive activities, child developmental milestone tracking such as ages and stages, connection to pediatric healthcare, and so much more. Next slide. The Ages and Stages questionnaire or monitoring program is free of charge, and you can enroll with it online or by calling the number that I had previously said. This is a developmentally supportive program that provides activities and also assessments to make sure that children are on track developing, and also primes and helps support parents in understanding areas where they can support their children's growth and development. Next slide. Some of the other resources that Help Me Grow Connecticut centralizes for all families, for all providers, for young children is AAP's Healthy Children efforts, Ages and Stages, as I've talked about, the Birth to 5 Watch Me Thrive materials and app, the CDC recommendations, inclusive of those on COVID-19, early learning and development standards here that OEC champions, early periodic screening, diagnosis, and treatment programs for young children, information, promotional activities, and supports about learning the signs about child development and acting early with questions and concerns, and also access to and help with leveraging Vroom, which is a developmental promoting app with activities, games, and advice. Next slide. The need for an early childhood system that supports young children's development, strengthens families' capacity to mitigate stress, is available for all when there are questions and concerns, and links to available and appropriate community-based programs and resources has always been a need and has always been something that we see in the ALICE 2020 data report, and actually the 4 years prior, confirmation of necessary in order to support the families and our community's health. But these unprecedented times have made Help Me Grow critical and essential, not just something that we hope is there. I thank you for the opportunity to be a part of this discussion in this panel, and look forward to continuing to support the ways in which we recover from the pandemic and also support ALICE families. Thank you.
Thank you, Kimberly. As a program director of the Boys and Girls Club of Stanford, we also see a number of families who are struggling during this time because of the limited capacity. They're unable to enroll into our program. So we have so many families that are struggling with after-school childcare and for the days that the children are on their hybrid days. So this information I will definitely share with my families that you shared here tonight. I thank you very much. And the resources that are available for the ALICE families to help make access to quality, affordable childcare easier, that Kimberly shared, to help us all learn more about what we all can do together to create change, is Emily Byrne from Connecticut Voices for Children. Hello, Emily.
Hello. Thank you so much, Melissa, and thank you to our partners at the United Way for lifting up this incredibly important topic. I'm excited to be joining everyone tonight. As you heard, my name is Emily. I'm with Connecticut Voices for Children. We are a statewide research-based advocacy organization, also known as a think and do tank. I want to run through the slides. I'll make sure to talk as slowly as possible, but I am a fast talker. If we could go to the next slide, please. Great. So our vision, which you see here, is why we do what we do. Our mission is what we do. Our values are how we do what we do. Our new strategic aim is toward economic justice. which we use as an umbrella term for a variety of anti-racist policies that together counteract the negative impacts of historically racist policies in this country that prevent equal opportunity to income and wealth creation. We prioritize affordable housing, criminal justice, fair employment, fair taxes, a values-based budget, and the myriad of intersecting issues that advance family economic security. That said, we know that true justice in any respect is impossible to achieve without a comprehensive package of policies that address all the different aspects of our lives. But for people of color, and particularly Black and Latinx families in Connecticut, economic class is primarily determined by the historically rooted policies and practices within the issues I just mentioned. So I promise we're going to dig into childcare data. But before I do, I just want to read a quote, next slide, from the Century Foundation's latest report that underscores this point. And it says that the communities at highest risk from COVID-19 are also the communities that have been most shortchanged in terms of employment, work-family policies, access to childcare, and income and wealth inequality is not a coincidence. The root causes are the same: structural racism and sexism. Long-standing inequalities entrenched in our laws, institutions, and cultural norms had already pushed many families to the brink of collapse, and COVID-19 may be the final push for too many working mothers. So I wanted to start with this quote because I think it perfectly captures how we got to where we are and speaks to the urgency of now for rescuing the early childcare sector. Next slide. Oh, great. Stay here. So it's pretty, difficult to read the paper or watch the news on TV these days without, hearing about the sector and how it's in crisis. The fragility of our childcare system has never been more apparent. And for the parents and providers out there, I know they feel this pain deeply. But as we heard from the commissioner, the early childcare sector was in a state of crisis even before the pandemic. We heard a lot of important data from both the commissioner and Kim, but I want to drill down on two main issues tonight that highlight why early childcare matters to us at Voices. The first is the impact on children, particularly children of color, and the second is the impact on the economy, particularly the participation of women and women of color in the workforce. So next slide. The commissioner and Kim spoke to why the first 5 years of a child's life are critical to lifelong health and well-being, and high quality childcare provides a strong foundation. Access to early childcare is especially critical for children of color, who are more likely to face adverse experiences as young children, which include excess stress. And I raise this because we all know from experience these many months just how stress-inducing the pandemic has been. But for Alice families and children living in Alice families, the path to success really has been marred by the pandemic. We heard from Kim that young children are experiencing food insecurity at unprecedented levels, in modern times. And because of the confluence of income inequality, unemployment, and pre-pandemic shortage of affordable housing, families are experiencing an eviction crisis across the country and across the state. Black, Latinx, and Indigenous women are especially feeling the multiple effects of being more likely to have lost their jobs, being on the front lines as essential workers, and solving their childcare challenges on their own. So without question, overburdened and under-resourced families and their children are experiencing unprecedented levels of stress attempting to navigate the myriad of challenges and crises, and these impacts are magnified when viewed through a race equity lens. Next slide. Many of us know that early childcare is an educational foundation, but as we heard from both the commissioner and Kim, it is also an industry, and one that is largely led by women and women of color. In 2016, Connecticut's early childcare industry brought in $718 million in revenue, and government spending on early childcare created an estimated $558 million in economic activity. The long-term economic returns through increased earnings and a decreased need for social services of those enrolled in childcare is truly significant. Unfortunately, as we heard from the commissioner, the sector is experiencing closures at unprecedented levels and pace. And this not only impacts children, their families, and providers, it also impacts the economy. Next slide. I think it's worth diving deeper into the economic impact. So we're going to take a moment to do just that. At a national level, the nexus of the pandemic and the lack of affordable childcare is instigating a growing exodus of working mothers from the workforce. The commissioner touched upon this. While the data that you see here is pre-COVID, we know that the state's labor force participation rate percentages have dropped across the board, and especially for women. And as you heard from the commissioner, the state has lost over 47,000 early child care slots as a result of the pandemic. So a back of the envelope estimate from us at Voices is that this equals to more than $9 million from the sector alone in lost economic activity every week. So every week we lose $9 million, and this doesn't even include the economic activity of parents who've left the workforce to take care of their children because of the pandemic. So, this speaks to the fact that more women in the workforce only helps grow the state's economy, and childcare is a pathway to getting more women in the workforce. Our research at Voices finds that increasing the share of Connecticut children in paid care by 7.5% may be associated with a 4% increase in the women's labor force participation rate. And if we dare to imagine enough women entering Connecticut's labor force to equal the men's labor force participation rate, there would be an additional $7.3 billion circulating the state each year. So this is what's possible. Next slide. But it can only be done when policymakers are intentional about racial inclusion and equity, gender inclusion and equity. And last, but certainly not least, as a society, we need to start viewing early childcare as essential infrastructure. There has never been a more important time than now as we're rebuilding the economy from the impact of the pandemic. And so you may be thinking why this is. Next slide, please. I think it's best explained by Mildred E. Warner. All other infrastructure sectors in our economy receive significant public support because we recognize that the private sector alone cannot bear the cost of a quality infrastructure. Public goods require public investment. All of society benefits from quality childcare, but parents still bear the costs of the majority of the costs. Next slide. And so for us at Voices, we're fighting with a coalition of providers and advocates for universal access to early childcare. For us, this means high quality care for children, fair compensation for workers, affordable care for parents, and we should be doing all these things through an equity lens. We know that since 2003, fewer children in lower income school districts have attended preschool than children in higher income school districts. We know that family child care workers who are disproportionately women of color are earning a measly $6.10 per hour. And we know that Connecticut has the 5th most expensive rate in the nation, making it impossible for Alice families to save and create wealth. So what are the action steps? Next slide. We need a combination of state and federal short and long-term solutions. The 4 that you see here directly relate to the early care sector, but there are other structural economic policies that certainly need to be addressed. That said, at a state level, we need universal access to early child care, and we can make inroads by dramatically expanding and increasing care for kids. The second point you see here speaks to more resources for the OEC. I think the Office of Early Childhood is doing a phenomenal job. We're truly lucky to have Commissioner Bai at the helm of the OEC, and you can see her leadership in the Governor's Workforce Council strategic plan. While there's certainly more needed for the strategy to encapsulate the shift to infrastructure, I think it's a really good start. It gives me a ton of hope. It expands access while also centering equity by focusing on family child care providers. It folds in business to be part of the solution, and it lifts up the fact that early child care workers need to be paid a fair wage without shifting the cost burden to parents or asking providers to make up the difference. That said, I think the OAC needs more resources to execute effectively and potentially even speed up the already aggressive timeline that's listed in Strategy 3.1. But those are the state solutions. At a federal level, Congress needs to stabilize the sector. The sector is on the verge of collapse, and providers need immediate relief. This is a huge problem. Huge problems require substantial resources, which states really don't have. We think that the Child Care is Essential Act is a critically important first step. The bill sponsored by Congresswoman Rosa DeLauro and providers and advocates across the state, including us at Voices, have been working together to advance this effort. We should continue doing so. But I think at a federal level, we need to really be talking beyond universal access. Fortune reported recently that the cost of center-based childcare exceeded college tuition in 28 US states. It's worth repeating, childcare exceeded college tuition in 28 US states. Look, other countries have figured it out. I think universal early childcare is not only worth considering, it may even be necessary given how the pandemic continues to unfold. Next slide. So look, lots of work to do. If folks want to get involved, they can reach out to me. We'd love to work with you or connect you to our partners at the Early Childhood Alliance, which is led by Meryl Gay, or if you're interested in funding this work, the Early Childhood Funder Collaborative, which is led by Carol O'Donnell. And of course, you could reach out to Kim and the OEC. Or reach out to any of these organizations and us directly. The point is to please get involved. The time really is now. So thank you so much for listening. And with that, I'm going to turn it back to Melissa.
Thank you so much, Emily, for providing context around why advocating for quality, affordable childcare is critical for the success of Connecticut residents. We have a few minutes to take some questions from the audience. Thank you for submitting those questions via the chat room. The first question we have is, did Kimberly say that the Help Me Grow program was able to provide these financial supports?
Actually, so is a good question. I was giving examples about how help throughout this country have been responded. At the National Center, we did secure some national philanthropy dollars and dispersed it to help support some of these emergency basic needs in May, June, and July of this year. Right now, Help Me Grow Connecticut is not providing formula or financial resources. I do know, though, that they are connected with the diaper bank and are helping to support with kind of diaper deserts and diaper needs.
Yeah, I'd like to add on to that formula has been an issue we've identified during the pandemic. And while food requests are up hundreds of percentage points, our Wic enrollment is not up at all. And so we've really been trying to work with DPH and DSS to encourage Wic enrollment. And I'm grateful to Lisa Tepper Bates and United Way because they've been helping us document this need to try to have formula available at food banks. I've never run into something as complicated as trying to get families formula. You would think it would be the first thing, but the complexities of it running through a pharmaceutical company and the complexities of Wic and the complication of breastfeeding and concerns about not encouraging breastfeeding make it all complicated. So I just wanted to add that is a real need out there.
Thank you so much. Do you have another question? The next question comes from Representative Robin Comey. Are you considering childcare deserts by town or by region? And the second part of this question comes from Wendy Orlando DeLuca. How does each county region compare?
I would just say that this is a map that's put out by the Center for American Progress. So you can sort of see by town, but you can also see counties, and there are regions where it's a bigger problem, like southeastern Connecticut. It has big challenges with childcare, as does northwestern Connecticut. But it's fair to say that the entire state, when 80% of families can't afford infant toddler care unless it's subsidized, it's fair to say the entire state suffers with this, and families across the state, middle income families. I mean, even families that might be considered upper middle class, if they have housing, they need housing, childcare, and they're paying off student loans, they can't really afford high quality childcare without a subsidy. And in Connecticut, we're set at 50% of the state median income. So that's like a family of four making a little over $40,000 a year. So it's most families don't qualify for subsidies. I don't know, Emily, if you want to add anything, but I just think the whole state is challenged.
Just underscores the need for us as a society to really start viewing childcare as essential infrastructure. It is a public good, period, end. And so the faster we can start getting ourselves with this mindset, I think the faster we'll all be to really using that energy to solutions.
Thank you. This concludes the first in the four-part Connecticut United Ways Alice Report Town Hall series. Thank you to our esteemed panelists who dove deeper into the data, shared resources available for families looking for assistance, and continue to advocate for the success of every child and every family in Connecticut. And thank you to all who have tuned in across the state. We know the topic of childcare is top of the mind as families navigate distance learning during the pandemic. And we hope you found tonight's discussion informative and inspiring. If you or someone you know is searching for assistance, I encourage you to call United Ways 211 or visit 211ct.org for quick access to resources. 211 is made available to all Connecticut residents through a partnership between the state of Connecticut and Connecticut's United Ways. If you or someone you know is interested in giving help, thank you in advance. I encourage you to contact your local United Way. You can also show your support for Alice households by giving to your local United Way. United Ways across the state are committed to ensuring every child has the opportunity to succeed, and this includes investing in quality early childhood education programs and COVID-19 response efforts. You can also get involved in virtual volunteer opportunities through the United Way in your community. We hope that you will help us spread the word about the 2020 Alice Report and the issues facing our state and communities. And no one organization alone can solve the complex issues addressed in the report, but there is power in coming together like we did tonight. And that is just what local United Ways are doing all across our state. Tonight's conversation is just the beginning. Save the date for the second in our virtual town hall series. Join us Tuesday, January 19th at 8 a.m. as we explore homelessness and affordable housing. Until then, stay safe and be well. We wish you and your loved ones a happy and healthy holiday season. Thank you and good night.